I'm Hanna Mascari.
And I'm Anna Valliant, and we're graduate students at Baldwin Wallace University, and we were supervised by Dr. Colleen Visconti.
We conducted a pilot study that looked at the effectiveness of parent training in an early intervention program, specifically looking at quality of life outcomes. Our study looked at whether caregiver and parent education in an early intervention program can increase their own quality of life as well as their perceived quality of life for their child. Firstly, we looked at the importance of early intervention programs. Early intervention programs are effective in overcoming cognitive problems, such as delays in speech and language. Also, they can be essential to developmental growth. We also looked at caregiver and parent-led intervention programs, such as the Hanna It Takes Two to Talk. A study conducted in 2017 found that parents and caregivers had increased confidence using the educational tools that they were taught in the Hanna It Takes Two to Talk program inside and outside of the therapy room. Finally, we looked at quality of life, which is a subjective evaluation of both positive and negative aspects of life. A lot of quality of life studies are conducted with adults with communication disorders, such as adults with ALS or Parkinson's. What these studies have found is that increasing communication increases quality of life. What makes our study unique is that not only do we look at the caregiver and parent-led early intervention program through education, we also look at their quality of life and how they perceive their own child's quality of life.
Our methodology consists of finding and recruiting participants from the Baldwin Wallace Speech Clinic. All of our participants were found through the summer of 2017, and we had 7 male participants, age ranges of 2 years to 1 month to 3 years to 6 months. All of these children had a diagnosis of deficits in speech and language development. Along with the children, we also involved parents and caregivers throughout the entire process. To talk a little bit about our program, we had 2 graduate students that led each program. Along with those graduate students, we had a certified and licensed speech-language pathologist who is also a faculty member at Baldwin Wallace University. Our program consisted of 4 hours per day for 4 consecutive days. During that program, we targeted a bunch of different speech and language development milestones. We looked at feeding and fine motor tasks, along with looking at using adapted books and a visual schedule to help children and their parents and caregivers to stay on task and to figure out exactly what our day was planned. We also provided the parents and caregivers throughout the session, but also at the end of the session with strategies and handouts that discuss their child's speech and language development. Along with some verbal communication, we also provided simple sign language to the parents and caregivers and the children if that was a better means of communication. To take our data, we provided 3 surveys. We did one at the beginning of the program, so we provided a computer for the parents and caregivers to fill out here at Baldwin Wallace, and then at the end of the program, we had the parents and caregivers fill out another survey, a shorter survey looking at the quality of life of their own as well as their perceived child's quality of life. Then 4 weeks post our program, we also sent out a survey to some of the parents to participate to, again, rate their quality of life and rate their child's perceived quality of life.
For our results, we used a one-way analysis of variance to see the changes in quality of life for both parents and caregivers and also their perceived quality of life for their child. What we found is that caregiver and parents' quality of life increased from 5.7 mean to a mean of 8. However, the perceived quality of life for children was a slight decrease from 8 to 7.6 mean.
So our discussion that we kind of talked about is we saw an increase in quality of life in the parents and caregivers who completed all 3 surveys. Unfortunately, we aren't able to say for sure, the increase in quality of life because of other external factors such as a small, limit. As well as only 3 of our parents and caregivers completed the last survey, giving us a little bit of a skewed results for that portion. As well as we had a small sample size for our participants, which may have led to some of the results as well. Because of our parents and caregivers responding in that 3rd survey, that may have caused a reason in that decrease in the parents and caregivers' perceived quality of life for their child. So factors are unknown for those, but we have found that our study does show the importance of how quality of life can be improved for early intervention. Some future ways we thought other future studies could target would be to increase the sample size, as well as use different types of survey techniques or more driven ways to look at research as opposed to just a survey method. We also found that if we could expand the duration of the program, that would also be helpful. But overall, we both found that the quality of life for parents and caregivers involved in an early intervention program does increase when they notice that their child's communication increases, just like those adult studies. So we do think it is important to further this, research and to continue that early intervention program quality of life studies. Thank you.